All right, let's dive right into a really fascinating medical puzzle. Imagine you have all the symptoms of a serious intestinal blockage, but when doctors go in to look, there's absolutely nothing there. It's a mystery that forces them to look for clues not in what they can see, but in the invisible rhythms of the body itself. I mean, it sounds like a riddle, right? How can your gut be completely blocked when there's no physical thing in the way? But for a lot of patients, this isn't some brain teaser. It's a painful and incredibly frustrating reality. And this is the central paradox we're going to unpack today. The condition has a name: chronic intestinal pseudo obstruction, or CIPO for short. And that word pseudo, which means false, is everything here. The symptoms are 100% real: the pain, the bloating, the feeling that nothing is moving. But the cause isn't something obvious like a tumor or twisted bowel. The gut itself is just failing. So you can see what a huge challenge this is for doctors. If it's not a physical block, then what in the world is going on? Are the muscles in the intestine just too weak to do their job? Or have the nerves that are supposed to be orchestrating everything gone completely haywire? To figure it out, you need a special tool that can actually listen in on that secret conversation happening inside the gut. And that brings us to our sleuthing tool, the key that unlocks this whole puzzle. To solve this mystery, doctors turn to a really powerful technique called manometry. So, what is a manometry? Well, you can think of it like an EKG for your gut. It's a procedure that measures the pressure, and this is the important part, the patterns of the muscle contractions inside your digestive system. It's not just checking if the muscles are moving, it's reading how they're moving, the rhythm, the strength, the whole coordinated dance of those waves. And this is where it gets really amazing. Manometry doesn't just give you data. It reveals distinct telltale patterns. It's kind of like learning to read 3 different secret codes, because depending on what's truly wrong, the gut sends out a completely unique signal. So let's start decoding. This table really lays it all out. If the muscle itself is the problem, that's called myopathic. You see these weak, low-amplitude waves. If it's a nerve issue, neuropathic, the patterns are just chaotic and disorganized. But if there is some kind of hidden mechanical blockage, the gut actually fights back, and you see these super powerful high-amplitude waves. Knowing what these different signals are telling you is absolutely crucial. So let's break them down one by one, starting with that first one, where the problem is in the muscle tissue itself. We call this the myopathic form. With myopathic CIPO, the manometry reading is just weak. The waves are there, but they have a really low amplitude. It's like a faint whisper when it should be a strong, clear voice. This tells doctors that the gut muscles just don't have the power to contract properly. And you often see this pattern in the duodenum, which is the first part of the small intestine, and even up in the stomach. Okay, but what if the muscles are perfectly fine, but the problem is with the wiring? You know, the nervous system that's supposed to be conducting the whole show. Well, that brings us to our second pattern, the one for the neuropathic form of CIPO. Here, it is all about coordination, or the lack of it. The manometry might show that those big phase 3 contractions are irregular or just totally absent. Now, phase 3 waves are the powerful housekeeping waves that sweep your gut clean in between meals, kind of like a cleanup crew. Without them, things get stuck. And what's even more telling is that after a person eats, nothing changes. The gut doesn't kick into high gear like it should. That lack of response points right to a problem with the gut's internal nervous system. And that brings us to our third pattern. This is the one that sends up a major red flag, telling doctors that, hey, maybe there is a subtle but very real physical blockage here after all, something like superior mesenteric artery syndrome, where an artery is literally pinching the intestine. In this situation, the gut muscle isn't weak or uncoordinated. It's strong, and it is fighting. The manometry shows this battle in high definition. You see these huge, high-amplitude waves as the gut tries with all its might to push past the obstacle. You even see these things called retrograde contractions, where the waves are actually going backward, desperately trying to clear the path. So you've got these 3 completely different signals coming from inside the body, and being able to tell them apart, well, that's not just an interesting medical detail, it is absolutely critical for figuring out how to actually help someone. Because these different patterns point to completely different root causes. A weak muscle needs one kind of treatment, a disorganized nervous system needs another, and a hidden physical blockage might need surgery. Getting the pattern right gives doctors the roadmap to the right treatment. So let's just walk through that whole diagnostic pathway. It starts with a patient who has these confusing blockage symptoms. Then they use manometry to listen to the gut's activity. From there, they can identify the specific wave pattern, that signature. And based on that signature, doctors can finally figure out the true cause and get on the right path to treatment. At the end of the day, it all boils down to this one simple, powerful truth. In the confusing world of pseudo-obstruction, where your eyes can be deceived, it's the pattern of the gut's own contractions that reveals the true nature of the problem. And it really makes you wonder, doesn't it? From the electrical signals firing in our brains to the pressure waves moving through our gut, what other invisible patterns are out there, just waiting for us to decode them, holding the keys to our health?